You know, mission statement is a purpose or a reason for why we exist. And I'm really proud of our staff because they actually did this together, and you know, they were really passionate about having an expanded mission statement, one that not only included a short statement of the purpose, and that's of course the very first line of our mission statement, but they were very passionate. I have to say passionate. They would not let go of this. They wanted to include specific goals of care and their approach to care and some of their commitments. And as you hear their mission statement, you hear their underlying beliefs and values. And this is what our staff is committed to. This is what they believe in. This is what they want to accomplish in the clinic. And I believe that that helps to get those things done, and that helps them to be the outstanding staff that they are. Leadership helps make the team what it can be through their communications with each other and with the team members. If the team members don't know what our hopes and goals for the organization are, then we're not going to get anywhere. So that's why it's important that we are very succinct in what we know we can achieve and what we hope we can achieve. I am what I like to call the fixer. I like to take ownership, have our teams take ownership, and give the staff a way to be accountable and also to be accountable to them. We communicate with the other services to make sure we're all doing the same thing, and communicate concerns or suggestions to our medical leadership, Dr. Smith, and our program coordinator, Angela Murphy.
I have several managers and supervisors, and I try to work with them to promote an overall team that's focused on specific goals. Some of those goals are the Press-Ganey scores, the employee satisfaction, financial and budgeting issues, and also process improvement is something that we work on in several different areas in cardiology. And I try to work with the staff and the managers to achieve these goals.
Angela embodies quality every day, and she lets all of her teams know it. And through her work with our wonderful medical director, Dr. Smith, it just rolls downhill from there. They empower us all. They help us, want us to do better every day for them. And if you have that, then you're going to have a successful program.
I look at our leadership as setting the direction, and then getting people engaged to sort of follow in that direction. I really look at the leadership as moving people horizontally rather than a top-down leadership telling people what to do.
Whenever you have a team, you have to build the right team. The members that you have on the team are really important, and I think that heart failure has the right fit of employees on the team. The leaders have done an excellent job of hiring the right people. We have a group of talented individuals whose skills complement each other. And so there's an opportunity for many of the staff members to learn from each other and continue to grow over time. And our leaders foster that growth by encouraging opportunities for growth.
We're really only as strong as our weakest link. And that is that for what the patient experiences, if they have trouble getting through on a phone line, if the phone's not answered, or if information is not communicated between our staff in an appropriate manner, that's going to affect the patient. So, you know, our staff recognizes that, you know, our patients have difficult problems, that they're needy, they often travel from long distances, and we have to do everything we can, all of us, to make that happen. So part of the teamwork concept is really getting every member of the team to realize that they have to carry their load and their responsibility to move the team forward, and that if they're not doing that, if somebody's not doing their job at the highest level, that really impacts how the team performs, and ultimately that impacts what happens to the patient. Once the staff realizes that their job is very important to the patient and to our mission, and that working at a place that is making changes and having an impact in healthcare, a place such as Emory, that's a very important thing. Once they realize that, they become much more engaged, and I think they enjoy their work more.
There is no organization without teamwork. I believe in the systems theory, and the system says that for every system there are many parts, and every part has an important role in the whole. And so that's what a team does. Every individual person on a team has an individual role. It is very important. Every role is important, and we treat every role as important because it is a part of a team. If we work together, our whole is outstanding.
Teamwork plays a very important role in the Center for Heart Failure. They have a great team, and I think they have worked together to look at each team member and identify what their role is so that they know exactly what their role is within that Center for Heart Failure. And the team is involved in every aspect of the patient care. The physicians are involved. They're involved in staff meetings. They were involved in writing the mission statement that Angela helped draft, and involved with providing feedback for every staff member and the role of every staff member.
Well, teamwork has changed in the Center for Heart Failure Therapy over the last couple of years. We don't act as splinters now, we act as a team, whereas if we were short-staffed on this campus, we didn't think about asking the other campus to help, and vice versa. So now there's comfort in knowing that we can reach out to the other sites and not just be independent little states.
We're not totally there yet, but we're pretty close, and we're certainly a long ways away from where we were years ago. And it just it becomes exciting to come into work and to work in a pleasant atmosphere. As we're focused on improving outcomes and people see that there's improvement, then they get satisfaction from their job, but that comes from engagement.
Quality is our checks and balances for, are we actually doing what we say we want to do? If we say we want to provide optimal patient care, quality helps us to gauge whether or not we're actually delivering the care that we want to deliver or say that we are delivering. My advice to anyone who is looking at quality and would like to improve on performance is to take the data. We use patient satisfaction surveys, and there's a lot of good information on the patient satisfaction surveys that relates to a lot of different areas of the clinic. And for those who are using the hospital satisfaction surveys, they're also broken down into components as well. If there is a specific area that has some specific weaknesses, and I'll use the example of a nursing situation, if it says that they don't get callbacks in a timely manner and that's an area for improvement, share that data specifically with the nurses and say, this is an area that our patients have identified as a concern. And so the goal is to help the nurses to understand where their weaknesses lie. All of us want to do a good job. I think everybody wants to do a good job on their job. And the best way to know how you're doing in an environment that you work in is to get feedback. If you are never given the specific feedback that this is a concern, then you don't know or realize that that's an area that needs to be improved upon. And so as leaders share the data with staff, it should be shared in a way in which is helpful, constructive, give examples and strategies for improvement. Another example would be at the front desk. If there are complaints from the front about the front desk not being friendly, smiling, just share the data with the staff and give them some examples of how to be friendly and how to greet the staff, and so that they can improve.